Men over 50, let me tell you something most urologists will not say out loud. There is a spot on your body that controls blood flow to your penis better than any pill I have ever prescribed. And 90% of you have never even touched it with intention. Here is what they do not teach you in health class. An erection is not just arousal. It is a synchronized event involving your brain, hormones, blood vessels, and a group of muscles most men cannot even name. After 50, this system starts breaking down. Not because you are old, because specific structures in your pelvic floor are being neglected. I am talking about the perineum, that small area between your scrotum and anus. Right beneath that skin sits the control center for your erection. The muscles that trap blood inside your penis. The nerves that send arousal signals to your brain. The arteries that deliver oxygen-rich flow. Ignore the spot and nothing else you do will work long-term. In my 15 years as a urologist, I have watched hundreds of men restore function by targeting this exact area with one specific compound, castor oil. Not because it is a miracle cure, but because when applied correctly to the perineum, it addresses the root cause of age-related decline. Today, I am going to show you precisely where that spot is, the exact technique that works, and why this protocol can reverse years of weakening. But first, you need to understand what is actually breaking down inside your body after 50. Because here is what most men do not realize. An erection is one of the most complex events your body produces. For systems have to work in perfect sync. Your brain sends the signal. Your hormones respond. Your nerves carry that signal down to your pelvic area. And your blood vessels open wide and flood erectile tissue with oxygen-rich blood. I want to give you something that can make a real difference starting today. I have created a complete guide for you. 5 simple steps to boost your sexual health. This is not theory. These are practical, science-backed actions you can implement immediately. Inside this guide, you will discover the exact protocols I use with my patients, how to optimize your testosterone naturally, what actually reduces stress and restores function, the specific foods and exercises that support hormonal balance and blood flow. Everything is clear, specific, and proven. Go to the link in the description right now and get your free checklist. Take action today. Your confidence and health are worth it. If even one system slows down, the whole chain breaks. After 50, they all start slowing down together. Let me tell you exactly what happens. Your blood vessels lose flexibility. They get stiff, less elastic. When your brain sends that signal, vessels cannot open as wide. Less blood gets in. And the blood that does arrive is harder to keep trapped because your pelvic floor muscles are weakening too. At the same time, testosterone drops. 1 to 2% every year. Sounds small, but over a decade that adds up. And testosterone is not just about desire. It keeps erectile tissue healthy and maintains nerve sensitivity. When it drops, everything dulls. Those nerve endings in your penis that register touch and pleasure start to fade. The same stimulation that once triggered strong response now feels muted. Signals weaken. Your body struggles to maintain arousal. Then there are pelvic floor muscles. Most men have no idea these exist, but they act like a valve, contracting to trap blood inside your penis. That is what keeps you hard. After 50, if you are not using them, they atrophy. Blood leaks out. Erections fade. This happens slowly. So slow most men do not notice until morning erections disappear or they lose firmness during intimacy. By then, multiple systems have already degraded. This is where men give up. They assume it is just age, that nothing can reverse it. Wrong. Your body, even past 50, can still recover if you give it the right stimulus. And that stimulus targets the exact spot where all 4 systems come together. The perineum. Now let me tell you why this combination works when almost everything else fails. First, castor oil. You are probably thinking this is some folk remedy. Wrong. Castor oil contains ricinoleic acid. This compound does 3 critical things. 1. It reduces inflammation deep in tissues where chronic tension has been building for years. 2. It acts as a vasodilator, helping blood vessels relax and open wider. More space equals more blood flow. 3. It stimulates lymphatic drainage, clearing out waste that slows healing and reduces tissue responsiveness. This is not surface treatment. The oil penetrates through layers and reaches structures underneath. Now the perineum. Directly beneath that skin sits the bulbospongiosus muscle. This muscle traps blood inside your penis during erection. If it is weak or tense, blood leaks out. Running through this area is the pudendal nerve, carrying every arousal signal between your penis and brain. And right alongside are the pudendal arteries delivering oxygen-rich blood to erectile tissue. When you apply castor oil here, you are hitting all 4 systems at once: blood vessels, nerves, muscles, hormones. You're addressing the root cause in the exact location where it matters most. But if you do this wrong, you get 0 results. The technique matters. So let me show you exactly how to do this correctly. Here is the protocol I give every patient who walks into my office with this problem. First, preparation. Clean the perineum area. Dry it completely. Wet skin blocks absorption. Simple as that. Now the oil. Pure cold-pressed castor oil. I have seen men waste months using cheap pharmacy oil loaded with additives. Do not be that guy. Cold-pressed keeps the ricinoleic acid intact. That is what does the work. Take 1 teaspoon. Warm it between your palms for 30 seconds. Or drop the spoon in warm water for 2 minutes. Not hot. Warm. You want comfortable, not burning. Position yourself where you can reach the perineum easily, between your scrotum and anus. Sit. Lie on your back. Whatever gives you access without straining. Now listen carefully because most men mess this part up. Apply the oil using firm, steady pressure. You are working deep tissue here, not rubbing lotion on your hands. Press hard enough to feel the muscle layer underneath. Not so hard it hurts. Find that middle ground. Small circles. Slow strokes. Cover the entire perineum. 2 to 3 minutes minimum. Do not rush this. Your goal is muscle relaxation and blood vessel dilation. That takes time. Here is what separates results from wasted effort. Breathe slowly while you massage. Deep inhale. Long exhale. Slow breathing triggers pelvic floor relaxation. When those muscles relax, the oil penetrates deeper and blood flow increases. After massage, grab a clean towel. Soak it in warm water. Wring it out. Fold it. Place it over the area for 15 minutes. Heat dries the oil deeper into tissue. You should feel warmth spreading. That is circulation improving. Do this every evening before bed, daily for 2 weeks. Then 4 to 5 times weekly after that. This is not a pill. This is tissue reconditioning. Some men notice changes within days. Others need 2 to 4 weeks. Let me tell you what to expect. First few days, you might feel warmth in the pelvic area. Maybe a light tingling sensation. Some men describe it as the area waking up after being asleep for years. This is normal. This is blood flow increasing and nerve endings reactivating. Week 1 to 2. Morning erections start coming back. Not every morning at first. Maybe twice a week. Then more often. They feel firmer than they have in months. This is your body remembering what it is supposed to do. Week 3 to 4. You notice you can maintain an erection longer during intimacy. It does not fade as quickly. You have more control, more confidence. Now listen. Every body is different. Some men see changes faster, some slower. This is not a race. This is repair work. And repair takes time. But here is what most men do not expect. The bonus effects. Less tension in your lower back. Why? Because the same muscles and nerves that control erections also support your spine. Better bladder control. Fewer trips to the bathroom at night. Same reason. Everything in that pelvic region is connected. You are not just improving erections. You are restoring an entire system. But castor oil alone will only take you so far. If you want lasting results, you need to support this work from the inside. Here is what most men get wrong. They do the castor oil protocol. They see results. Then they go back to eating garbage, sitting all day, and stressing about everything. And they wonder why the improvements fade. Listen, your body needs fuel to rebuild. It needs the right materials to repair blood vessels, produce hormones, and keep nerves firing. Give it junk and you get junk results. Start with your plate. Leafy greens, spinach, kale, arugula, beets. These foods boost nitric oxide production. Nitric oxide is what opens your blood vessels wide. More nitric oxide means better blood flow to your penis. Simple biology. Add healthy fats. Salmon, walnuts, extra virgin olive oil. These provide the building blocks for testosterone. They keep your blood vessel walls flexible. Without them, testosterone drops and vessels stiffen. Now exercise. Specifically, pelvic floor exercises. Kegels for men. These strengthen the exact muscles that trap blood during erection. 5 minutes a day is enough. Contract. Hold. Release. Repeat. Do this consistently and your erections will not just get harder, they will last longer. And stress. This is the silent killer nobody talks about. Chronic stress floods your body with cortisol. Cortisol constricts blood vessels and crushes libido. You need to find 10 minutes every day to decompress. Deep breathing. A slow walk. Sitting in silence. Whatever works. This is not optional. This is medicine. Finally, water. Your blood is 90% water. No water, no blood flow. Drink enough that your urine stays pale yellow. Do all of this and the castor oil protocol becomes 10 times more effective. Ignore it and you are fighting an uphill battle. Now before you start, there are some critical safety warnings you need to hear. Castor oil is safe for external use, but only use pure cold-pressed oil. Never apply it to broken, irritated, or inflamed skin. That will cause more problems than it solves. If you experience severe pelvic pain, sudden changes in function, or blood, stop immediately and see your doctor. Do not mess around with serious symptoms. If you are on medications for blood pressure or heart conditions, tell your physician you are using this protocol. I am giving you a tool, not replacing medical care. Now listen, your body is more capable than you think. Even after 50, even after years of decline. With the right approach, the right stimulus, and the right habits, you can restore function that feels natural and strong. Try this castor oil protocol consistently. Give it a full month. Support it with proper nutrition, hydration, and stress management. Do not half-ass it. If this information helped you, share it with someone who needs it. You never know whose life you might change. Always consult your physician before starting any new health protocol. See you in the next video. Take care of yourself and trust your body's ability to heal.